Maria led the Research and Development Department in the US, Singapore, and Israel for Trirem Medical, where she applied her expertise in the medical device field. As Executive Vice President and VP of Research and Development, she was involved in all aspects of building of business, including strategic planning, budgets, acquisitions, mergers, and new product development, as well as overseeing U.S. operations and acting U.S. Division General Manager. As Executive VP, she became responsible for a successful startup IPO in Singapore and assisted in raising capital. Most recently, Maria led a startup company, Expanse ICE, as president, and during her leadership, the product obtained FDA approval, which is such a big deal, and initiated treatment of patients in the U.S. She continuously interacts with medical key opinion leaders on new product development and clinical trials, and she works directly with regulatory and financial auditors. A little bit about her educational background. After completing her BS in Industrial Engineering at Texas A&M, Maria started her career in aerospace and defense before transitioning to the field of medical devices, developing products for treatment of cardiovascular and neurovascular diseases. She has multiple patents and continues to innovate and bring new products to commercialization. And, which I didn't know, in 2023, Maria obtained a Master's of Law from Seton Hall University. She's also really involved in her professional community, and so in the year 2000, she became the first female national president of MIAS, which is Latinos in Science and Engineering, which is a nonprofit organization, and she is still on the National Board of Directors. And for most of her career, she's been an advocate for the promotion of STEM careers in the Latino community and for women, and received a gold medal for her community service. Thank you for all that you do. She's also spent a considerable time as a mentor, inspiring young people in underrepresented communities, especially women, to continue their education and pursue careers in STEM. Her mantra is "Giving up is not an option," and in her spare time, she enjoys hiking, traveling, and reading. I will turn it over to you. Thank you so much.
Oh, thank you.
Yeah.
I'm just going to turn this on because my presentation is already on. And I want to keep track of, be conscious of your time and respectful of your time as well. So I think this is such a wonderful program. I wish I had had it, when I was going to school. This is introduce you to different speakers, to different backgrounds, to what you can do with your career. So when I talked to Cheryl about also coming here and speaking, I just thought, what do I tell you? What do I tell you that you're not already learning, and stuff. So what I decided is that I'm going to put a few things that walk you through my path, and then maybe you can make some sense and get some ideas as to where you want to go and how you can face some of these challenges. I'm going to move this here for the clicker, and it's easier for me to be over here. So I think you've already talked about some of my educational background and my career background, but I will tell you a little bit about my early years. My father died when I was 2 years old, and my mother had to raise us, my siblings and I, and run a business and deliver a child to see she was pregnant at the time, and she was 22 years old, and she had to do all this, and this you're talking about being the 60s. So this was a little bit hard for her, but that also taught us, many things that kept being reinforced along the way. Just like you need to persevere, you need to keep moving forward. There's no moving back. In Spanish, there's an expression that says you don't go back, not even to give yourself a push forward, right? You're always forward. So anyway, so that was my upbringing, but always education was very important. And that's what led me to Texas A&M. Texas A&M, for those of you that are not familiar with the school, it used to be an all-male military ROTC school. And then they opened it up to what is called the non-regs, which were non-ROTC, non-military males still. And then at some point they opened it up to women. And there was actually people that wrote to the governor to try to prevent women from attending the university. So that is the background of a school that I entered, right? So again, it was very few women in engineering school. So most of my classes were not, I didn't see any other women, and I had to work in that environment. A&M, or College Station, where it's located, it's a very small city. It was very different from what I was used to. It was I would say it was a culture shock for me, but again, there's no going back. You know, it's just like you sink or you swim, and I chose to swim. Anyway, so those were my years. I graduated, I was poor, of course, you know, and so I needed to start working. There was nothing, I didn't really know that I could pursue, you know, my master's and actually have money to pay for it. All I needed to know is that I need to work. The other thing is that I was fortunate enough to have full scholarship for my school, and so I didn't have to work. However, that was one of my mistakes, not working, not having summer work, because that would have taught me whether that's what I wanted to do in life or what I was expected to do when I graduated. That would have been very helpful for me, which I didn't because I was fortunate enough. So what I did, you know, in the summers, I would just take more classes, so I could finish faster, and I could get a job, and I start working and make money, and you know. So that was the goal. I moved to Southern California and started working in Southern California. And then I started doing a postgraduate work in environmental engineering, because environmental is my passion. And I'll talk to you a little bit more about my career, but that was my path, my university path. And then lately, as you said, you know, I decided there was something called COVID, you know, when all of us were at home, and I was like, all right, well, I have too much time on my hands. I mean, I was working, right? But it was like, okay, what do I do with my spare time? So let's just do a law program, right? Like, why not? Something that I never thought I would do, because it was like, no, it's not technical. It's like just not, you know. But anyway, so I'll tell you a little bit more about that. But it was something that I've learned to appreciate. That's cool. And you know, what's important for me, and I think for all of you, you guys are here for a reason, right? Like, you're getting an education for a reason because you feel the value of this education. And for me, it opened many doors. And I'm going to say specifically, maybe engineering opened many doors for me. And it was up to me to be ready, you know, when that door opened, to be prepared when that door opened, or maybe to help that door to open because of what I wanted to do. And one of the other things that I always say is that the power of the education that you're getting in a university is critical thinking. It's not just, let's learn a formula, figure out the problem and turn it in, and not think about, you know, what the results are and what you're going to do with that, right? So often I have in my workforce where I have, you know, recent graduates that come in, and then you assign them a task, you do the formula, you do the analysis, and you come and give it to me. But I just say, I can do math. I can do math. What I need you to do is to tell me what you think. It's not that you're going to be right or wrong or, you know, anything. It's just that you need to be able to look at the whole picture and say, this is what it means, right? And this is what you're doing here in university. It's not just like learning formulas and, okay, you some classes you need to pass and you don't like it, that's fine, right? But the most thing is that you're learning, you're meeting people, you're learning about, you know, different cultures, your ideas, you know, where people come from and things like that. This is the most important thing. And nowadays, you know, we have algorithms that give us an answer, but how do we reach that outcome? That's the most important thing of all, and I'll touch on that a little bit. So again, my career started in defense and aerospace, and again, I was the only woman most of the time in the room. And then I have everything going against me, I'm gonna say. I was young, I was a woman, I had not worked anywhere in my life, you know, well I had, you know, but you know, it was more in fast food and stuff like that. But that, and then I was a minority. All these things coming to me when I'm sitting there with this very established environment, and where it was just like hitting my head against the wall every single day. It was like I didn't know anything, and everybody made sure that I knew that I didn't know anything, and they were not ready to teach me to do anything. So, so what I did is that I would go into different departments and learn other things. you know, even though it wasn't my job, right? I could have left at a certain time saying, well, 8 to 5, bye-bye, see ya. But I didn't, you know, I would just go in there and say, what are you doing? Let me learn this, let me do this, you know, let me understand, and try to push forward. But it came to a point where I was like, I am never going to reach beyond where I am, because that's the established. I hope it's gone better, but that was my experience. So that's when I decided to go into environmental, because I said, I better do something that I like to do, and I enjoy, and I, you know, everything. Oh, but don't take me wrong, you know, aerospace and defense, it was very high tech, it was state of the art. I was learning, you know, great things that were happening there as far as research, as, you know, engineering is just like a place to be. But at some point, you also need to look at yourself and say, is this the place for me? Is this the fit for me in the long term as well? So I moved into medical devices. Somebody hired me. It's very hard to move once you establish yourself in one field. People start looking at you as, you're this type of engineer, automotive, or you're this type of engineer, so, or you're medical, you can't fit here and stuff. So I'm going to say I was fortunate that I had enough experience to move into the medical device world. So there was this company that was looking for more experienced people. And some of my knowledge, my skill sets were transferable to that space. So I was hired, I moved to the Bay Area. I was in Southern California, I moved to the Bay Area. I have never looked back after that. That is probably where I should have started, you know, in medical devices. It was something that I was, you know, every day it was something that I did that was going to help someone else. That was like my personal reward, I guess, for my work. And then also the acknowledgement that I was someone that could deliver and contribute, and it was not, you know, demeaning to me, and things like that. There was still a glass ceiling, you know, you could still see a senior management that were a certain kind, and but it was still, the rest of it was very inclusive and very promoting of people to contribute in meetings and to be able to collaborate. So I moved up to, let's say, program management. I started in manufacturing, and then I moved into research and development. I did, you know, program, and then project, and then program management. Then I moved into the senior level management positions. So I went from very large corporations to small corporations to even smaller companies. And then when I was in the smaller companies, then that's when I went from director to VP of R&D. And that still to this day, you do not see representation. And it's not because we're not capable, it's not that we don't have the skill set, it's because either they don't see us as being able to be in those positions, or because we don't put ourselves out there to be able to demonstrate that we can do it. You know, from early stage companies, you know, then I moved, and this is where we took, you know, one of our companies went and we did an IPO, which is the initial public offering. We go public, and that was a completely. By the way, you know, with the education, I always kept on learning, always taking classes, even though I was done, and I'm like, okay, I'm done. No. Always taking classes and everything, and I even took a tax class, economics class, and this was after my work day. But the tax class, it actually helped me so much, because even to this day, I understand, it's not that I know all the laws and everything that changes, but I understand what to do with my money, you know. I understood my everyday life, like what I spend and what I do and things like that. And it also helps me with my company, you know, as I'm looking at the finances, to say what is the, you know, if I do this or I do that, you know, what is the outcome. So anyway, so that's a little bit more. I'm going to tell you about medical devices. I already said that it's, you know, it's a very rewarding. I want you to stay with me, because I'm going to talk about many different things, but I hope that it helps you to see how everything falls together, and it can show you, maybe help you to see different paths, you know, in your career. So medical devices, we actually hire different backgrounds. You know, we can have mechanical, we can have, you know, packaging, chemical, electrical, we have biology, chemistry, we have all sorts of backgrounds when it comes to, let's say, engineering and science, because you need it, you know, when you're looking at all these other requirements that go into devices and also in pharma as well. But we also look at the disease stage, right? Like with anything, you have a problem, we're engineers or scientists, you have a problem, we need to solve it, right? We don't come up with a solution and then try to solve nothing, right? So it's always, there's a problem, there's a solution, and in business, is there a market for it, right? Because come up with this wonderful thing, spend all of this wonderful money, and then you're not able to give it to anybody or sell it or anything of the sort. So those are some of the requirements. So then you also have, you have to consider your standards, your regulations, what's your regulatory path, whether you're going to be submitting in the US, whether you're going to be taking it to Europe and to Asia, and all these countries have different requirements for your product. And then also the standards, it's like what type of testing do you need to do and to prove that your device is safe to be able to, to put in the, or take it to the market and get approval. Material properties are also very important in this space. By the way, this is a whole session in itself, but I'm just going to run quickly through it. The material properties is that the things that we need to consider is that these materials are going to be used in the body, right? So, and some of them are going to be implanted, are going to go in the body, and we cannot, risk a patient getting an infection, or something like that. So you need to consider this comes your materials, right? Like you have your corrosion. You've got to be able to that it's not corroding. Something that you're going to implant that is going to be protected from that over a period of time. That is not going to fracture. So you need to look at your stresses of materials and things like that. From a science perspective, you need to look at the biology, right? Like what is it causing it to clot? Maybe you want it to clot. There's some sort of situation that you do want it to clot. You want it to have a reaction, not a bad reaction, but a good reaction. So these are that sort of things. It's highly regulated where you need to be able to say, this phase I'm going to do this phase I'm going to do that, and then I'm going to verify and validate, and then I'm going to go into approval, so I'm going to do clinical studies if I need to. Preclinical studies involved either in vivo, in vitro, and also we can do cadaver studies. The beginning when you do that, you're like kind of like, I try not to do them because it was just like, oh no, I cannot do this, but you gotta do what you gotta do. And keeping my, what I believe in, when you're looking and designing things, I also say, because most of the time, like medical devices are single use, the ones that I work in, which means that it's going to go into the trash, right? So you need to look at the impact also, like the environmental impact and also sustainability of the whole industry as a whole. And you have to introduce your quality. Something that is also very important, and it's also, I think all of you are probably involved in AI, and this is the up and coming thing, and it's going to be very helpful in this space. But you also need to consider that there's privacy and there's cybersecurity, and these things need to be considered because you cannot disclose, let's say, patient information. You just cannot disclose it, right? So if whenever we are designing something, we need to also keep that in mind as we move through, through the process. Okay, so now I move to a startup, right? I have all this background, and I'm like, yeah, I can do this. I can do this. I'm at the top of the world. I have all these, not that many people. Startups start with very few people, and sometimes you start in your garage, but that sort of thing. So you have an idea, and then you come up with a prototype, and you do kind of market analysis. You determine how much it's going to cost you, to be able to commercialize this, and then you get some funding, and then you also have to value your intellectual property. By the way, intellectual property is part of the value of the company. So it is very important for you to safeguard this information once you go into a company, or even yourselves, right? Like we can all go in and file a patent right now. We just need to be able to demonstrate that it's going to work, that something else doesn't exist. but it says the value of the company. So when someone is trying to, let's say, sell the company or get investment, they say, but I have all these patents, and they cannot be challenged. So it's a value added. It's not money itself that I have in the bank, but it is, because I can sell it, as an idea. So this is something that, again, with AI and everything, these are things that need to be safeguarded as well. I know it's very easy for us to ask ChatGPT, right? What do you think about blah, blah, blah? But we need to be careful of not introducing something that is now going to become public, and you've already made it public, therefore the company cannot protect it anymore, right? Because if they haven't or filed for a patent, then it's now put it in jeopardy. So those are the considerations. So in reality, this is what it is. This is what it was, right? It's just like, you're really at the bottom because you're carrying all this, and you need to make sure that it's no longer, well, my manager will take care of this, or something. It was more of, you're it. You are responsible for all these things. You are responsible to pay the people that are working for you, to pay your suppliers, to make sure that you're following the your design control, et cetera, et cetera. That's you. That's really what it is. And then you still have the same other things that you have in a regular company, except that you have a smaller group and you need to move fast. So again, in the development, safety is first, and with knowing that risk can never be zero. Okay, maybe never, maybe sometimes they can be zero, but for the most part, you need to be able to mitigate those risks, make sure that it's going to be a safe product that is going to go out into the market. And then there's times when you say, is the benefit, or does the benefit outweigh that risk? And is there nothing else that can treat a certain disease or a certain patient population, but there is a risk, right? So you need to be able to mitigate as much as possible, and then to prove that this is beneficial to the to the patient, and then understanding. I don't know if when you go to the doctor, you sign all these forms that say you accept blah blah blah, and this and whatever. And I know I had surgery one time, and it said, and then you may die. Well, that's wonderful. But it is the reality. It is the reality of anything that we do. You can walk outside and I can run over by car or something, So there is, but you try to mitigate this risk. And then you also have to get the input from the customer and the user as you're developing products. Something important for everybody is time to market, because you can have the most perfect device that has zero risks and do the most wonderful thing, but you're 5 years too late. It's like, okay, well, that's wonderful. Pat yourself in the back and everything, and then you can't do anything with it. So you do have a timing that you need to be entering this market to be able to be competitive as well. And then you have to have an exit strategy, for the startup. Because when you go ask for funding, they'll ask you, okay, so what's your exit strategy? Because they want to know, if I'm going to give you money, if I'm going to ask you, if I'm going to give you $10,000, or you're going to give me $10,000, what do you think you're going to ask me?
If you're going to give me, or if I'm giving you.
You're giving me $10,000.
What are you going to do with it?
It's like, what are you going to do with it? I mean, you're going to ask me, what are you going to do with it? And when am I going to get it back? And if I give you $10,000, I want $20,000 back, right? Because it's going to take you maybe 10 years. So that sort of conversation happens, right? So one of the questions is, what's your exit strategy? Oh, my exit strategy is that I want to sell it. Oh, okay. So if you're going to sell it, that means that the market is going to pay this much, and you're going to sell it for however much, and I'm going to give you this much, and I'm potential of getting this much back. So that sort of conversations are occurring. So these are all things that we're like balancing, as we're I didn't pick on me. These are all the things that we're trying to balance, and in reality, this is what it is. Every day you're like pushing, trying to get your world up, and heels. By the way, no, you never do, because you're having to go to the lab and you have to have closed toes and all that sort of thing. And then if you decide that your exit strategy is commercialization, that is commercialization, then again, you need to look at time to market, you need to look at your supply chain, how much it's gonna cost you to make this product and how much you're gonna sell it for, and if you're going to have a certain type of reimbursement. And then supply chain is, you look at all your vendors and your materials, and you try to optimize that as much as possible to be able to get them, in a timely manner. By the way, when we had during the pandemic, around that time, there were some vendors that were giving us a lead time of a year, 2 years. A larger company may be able to survive because they have inventory and they have also more money power to be able to say, well, put me in front of the line. But a small company cannot sustain that. A small company is like, well, I can't wait 2 years to get this product in, right? Like to get this material that is essential for my product. You just cannot. So what do? You have to go to other sources, right? Whether it's outside of the US or everything. You need to go outside, but most of the time, or you have to do it really, to optimize it, you really need to do it before you get your approvals, before you complete all your training, because otherwise, you're going to maybe have to go through a reapproval process and a retesting, and some of these cost money and takes time, and et cetera, et cetera. So that's your supply chain. So with your cost of goods, I'm going to show you some of these, and these are not to scale. It's an example, oversimplification, but it'll give you an idea, right? So for your cost of goods, you're going to look at your material, your labor, and your overhead. And this you want to keep as minimal as possible because this is what is going to drive what you sell your product for, right? Like how much are you going to get for your product, so you want to keep this low. Overhead is, your quality, your inspectors, your packaging, your accounting, all these people going to overhead. If you're a large company with like 1 million products, then you distribute this among all your products, which becomes very low. If you're a small company, with one product and this overhead, you're going to carry this whole overhead, right? So you want to minimize this overhead. You want to minimize the material cost and the labor cost, so that you're able to sell it. Plus you have your regular R&D and clinical. Again, clinical can be like for pharma. This can take 10 years to get approval, and at the end, maybe you don't have anything. Your clinical studies say it's not like you didn't prove what you wanted to say, what you wanted to prove. But it's a huge expense that you also need to look at it, from the company as a whole. And then you have something that's called sales team. And the sales team is very expensive. It's very, very, very expensive. Did I say that it was expensive? Yeah, it's very expensive. This is like very expensive, but unless you have a distribution agreement or you have other ways, direct to customer or something like that, this is something that you are going to need to be able to go into the market and increase your volume. Maybe you can do it in the beginning with a few people. Definitely you deploy your R&D, to team up, to your engineers to team up with your sales team to, go out there and, do all the selling and the song and dance. I mean, it's not song and dance, it's the real thing. But what if you have changes? Like the ones that I mentioned right now, when you have a material that now it's taking 2 years to get in-house, you need to make a decision of whether you're going to make a material change or you're going to change from that supplier to another supplier. And if that's the case, then what does it mean, for the entire cost and for you to keep on marketing this product if that happens? You can have a process change. For instance, we have most of the devices will get sterilized, and we had a situation recently where most of the, and this is for ethylene oxide EO sterilization, they were shutting down because they're causing, ethylene EO is very carcinogenic, right? So it can cause cancer, and they needed to make changes to their facilities to stay open. But they were shutting down, which meant that most of the medical devices, or all of the medical devices are going through that process, which means you either have to go outside of the US to get it sterilized and then bring it back in, and all sorts of things. But once you have it validated, again, you have to go through the process of submitting it for approval, proving that you're not changing your materials, the property of your materials, all this, etc. This. And then you have this recent thing that you've heard of that's called tariffs, right? So So the tariffs are charged not by the company that's, or the country that's getting imposed the tariffs, but by the person that's buying it. When you bring in some materials, and I've had this situation where I was bringing in some materials from China, and all of a sudden it's like, but the piece costs like $5, and I'm having to pay like thousands and thousands to bring it in, you know, only because it's made of steel or something, you know, something else, right? Those get, and then eventually they're going to be incorporated into the cost. There's no other way to do this, and it's going to lengthen your time, and potentially this could affect the customers. The patients in this case, because if the product is not available, then that means that you're gonna be treated with it. And doctors are gonna have to find other solutions for that problem. Talking about sterilization, what we had to do because of all this, and we couldn't find a sterilizer that would do it within the amount of time that we wanted it done, we had to go to Israel. So send the product, it was not small, it wasn't like this, it was this long. Send it to Israel. No direct flight, it goes to Germany or someplace, so it goes there, it goes to Israel, and every time it goes through customs, and people see this long box, and now you have to be able to code it properly so that it's not, held in customs, and then sometimes they'll open your box, and you're like, oh God, stuff. So there, it's sterilized. Finally, it gets there. Some of the boxes get lost, and now you're saying, yeah, but I need to start my testing, right? Like, so Bill, send another package, and we'll figure out the ones that are somewhere, somewhere. And then get it back, and then again, go through the same process of the US, receiving it in the US and everything, and hope that nothing is damaged by the time it gets here because you're gonna use it for your testing. Then this whole thing of the whole conflict in the Middle East happened. As we are gonna start our clinicals, and we're sending product to get sterilized, right? So that whole thing, and the only reason is because now you cannot find someone that can do it in a reasonable time in the US for you to be able to keep moving and stuff. So I know, we always did this knowing that we were going to have to revalidate, that means cost and time, revalidate in the US, because your supply chain cannot be that complicated. It just cannot, because you are just like set for failure if it's that complicated. Anyway, so those are kind of the things that we need to deal with, and hopefully not on a regular basis, but it seems like I would tell my team, please, no problems this week. We already exceeded our problems last week, so no more problems this week. They're coming with a problem, it's like, what did I say? Oh my God, I said no problems. Okay, I'm gonna walk you through a little bit about some of the disease and treatments that we do, and it's starting to work in the medical field. I just came to appreciate the body. It's just like, what a wonderful design, when it works, of course. But what a wonderful design. It's just like, you have like these muscles and the tendons and the arteries and the veins and the organs, this brain that I think is just like the most wonderful organ that we have, wonderful, and the heart, and everything is working, even if you're not thinking, like my friend's telling my hands to move my hands, but I don't realize that it's telling me to do that and to open my mouth and talk and whatever. So it's just, a fantastic design, I think. Well, I'm going to say that when you start looking closely, I say, well, who thought of that design? Like this joint here. I'm like, really? From a mechanical perspective, it's just like not a good design. It's like, okay, let's evolve into something else. So I work in strokes, and this is for when people have aneurysms, that they could rupture in the brain, and people can die if it ruptures and it bleeds into the brain. So actually, I was able to go and shadow a neurosurgeon, and one time they did a craniotomy, and a craniotomy means that you cut the skull and you put it on the side, and then through a microscope they go in and try to clip this aneurysm and do all this sort of thing. So I was able to go in and look at the microscope and look at the brain And of course, when you're in the lab, you cannot touch anything, right? Like anything that's blue, you cannot touch it because it's sterile. And if you touch it, they would probably have to change everything out, even though your gown and gloves and whatever. So you pretty much keep your hands back here because the tendency is to like, oh, this or that. No, keep your hands back here and don't touch anything. But that was quite interesting, like to shadow, one of the surgeons through the hospitals that was just like, oh my God, I was tired. And they kept going without food. And then some of the other areas are having to do with the coronary and peripheral vascular disease. And this is, when you have a stenosis or closure of the arteries. And then we had a situation where we went and we had this particular stent. Stent is this structure that keeps the artery open. But we go in to do our first in human studies, and something happened, and it didn't work. And then you're there, and the patient is there, and that's not good. It's not a good thing, right? Because the doctor's like, really? Of course, you partner with doctors that understand that this is going to be the first in human, and some of these things may happen, and stuff like that. But as long as you don't put the patient at risk. So it wasn't still in the patient. It was still where you were trying to set it up and it didn't work. And it had to do with a material change that had happened, from one of the suppliers, and it wasn't going properly and things like that. So we had to go back and make those changes and the revalidation, for us to be able to use the product. Some of the things with the vascular disease here, again, is like you could have a closure of the artery, a plaque, just plaque, and that's when, the legs start hurting, and you could start preventing, the flow of blood to the distal vasculature. And here you'll see, they use angiography. That means they're looking at a screen like an X-ray, at a screen, and the patient is here, and you do it manually, minimally invasive, so they go in through the arteries. Most of the time people use the femoral, they'll come here and they'll start treating the legs. But if you can see here, I'm going to show you, this area is the nose, right? It's closed. And then you don't see a runoff as you're going down into these areas. So when they put a stent in here, now you start seeing a runoff. But they also start noticing that there's some other problems that this patient has here. But at least they were able to fix this. Sometimes they will go back and try to fix as much as possible just so that the patient doesn't have to come back. And then here again, here you see how there's something here and there's no flow going down. The same thing here, there's no flow going into the foot. And things like this could happen if you are not, I'm sorry, I don't want to, but this is what it could look like. And acute ischemia means that maybe you can still salvage the limbs because you're trying to open, the artery. But there's times when it's too late, the patient waits too late to do this, then you can have an amputation of, starts with the toes and then the leg and wherever, because there's no way to rescue that anymore. So you're trying to design, technologies to be able to solve this problem, and maybe not have it go to that phase. Another area would be like thrombus. If you have like thrombus, I don't know how many of you have heard of like DVT or deep vein thrombosis. This happens when people are traveling and you sit too long, and then because you have valves. Look at it, it's so engineering. You have like valves that open and close, and then all of a sudden they're not opening and closing, and now you have like stagnation of this blood that can be clotting, and now it doesn't move, and it clogs the leg, and then you get up, and now you have pain. And blah, blah, blah. If it stays there, okay, you can go in there, they'll put you medication or can do a treatment and no problem. The problem is, or one of the bigger problems, is that if it becomes dislodged and now goes into your lungs. And this can be fatal if it's not treated right away, or, so this can be fatal. So some of the things that we do is like we use aspiration, just like taking your vacuum cleaner and trying to, the clot, remove it. Some people go in there and break it up, and then try try to aspirate it. But, you need to get that, sorry, I just think it's funny. It's literally that, right? So what people are coming with is just like, as we know, the bigger the tube, the more we're gonna be able to aspirate, right? But what is your limitation here? Your limitation is the size of the artery. So you have a small tube, it gets clogged. You take this clot, and then it gets clogged, and then you have to take it out and clean it and blah, blah, blah. So people are coming with different technologies so that that doesn't happen, that you're able to break down the clot and be able to aspirate it. So see here is just like that same thing that I showed you before. They'll see that there's no flow. By the way, thrombus is not really opaque, so they don't really know where the thrombus is. They just going in, they're blind and going and applying this and knowing that there's a blockage here somewhere, right? The clot is somewhere here. So I'm going to go and do it until not. So one of the interesting that you can bring in is having to put a visual help for them to be able to say, it's here, right? I can put it, but knowing that you have limitations right on the size of whatever you're doing, and putting something that's visual that to say, oh, I can see, I can navigate, and I can see the system, or other type of solution. So this is still something that can be worked out. As I told you, I'm moving on now. So now you've got all of this background of state. But now I was interested in this topic that's very current right now, and it's diversity. And I said, why is it a bad word? Why is it bad? Why is diversity bad? It's not bad. I looked it up, the definition, and it says many different forms, types, ideas, different components and different elements. Well, that's not bad, right? It's not a bad thing. Well, it's not. It's not a four-letter word, and we should not let it be a four-letter word because when you look at my world, which is when you're doing clinical studies, diversity is very critical. It's extremely critical. So, for instance, if you look at women's health, for clinical studies, women, and especially women of color, have been excluded from studies. So if you're trying to develop something, a drug or something, and it doesn't include half of your population, then how do you know it's going to be effective? How do you know that it is going to be helping them or not helping them? So you need to be including them. And then, when you do clinical studies, you don't necessarily analyze subgroups, and this is where AI and all these technologies are maybe helpful, because now you can take these data and analyze it quicker, and maybe look at the different subgroups and see how it's affecting that subgroup. And sometimes it could be positive. It could be that there's been cases where in pharma they have all these drug studies that last forever and ever, and that you're not able to prove what you were trying to do, but then you say, well, wait a minute, I can use it for this, because I've looked at my data, my subgroup data, and being able to analyze it to help this population. But this is, diseases for women, they may affect them exclusively, differently, and disproportionately, and this is 51% of the population, right? That you cannot just ignore or decide that diversity is a bad word and I'm going to use one size fits all for everybody. So you need to be able to include it. So these type of technologies or studies are consistently underfunded. And of all the VC or venture capitalist money that is put out there, only 2% goes to women's health. And one of the primary reasons is they say, well, the market is not there. That's one of the primary reasons. Right, because again, like if you give me $10,000, you want to know what you're getting back, right? And in your mind, you say, you're never gonna give me those $10,000 back, so you're not gonna give me the money, right? You're gonna invest it somewhere else. So, but if you look at it, population is 51% of women, 85% have the spending decisions, 80% make the healthcare decisions are women. This is the market and this is the reality. So so that's somewhere where diversity is good. Again, in the medical field, if you exclude other populations, children or elderly or people with chronic diseases, that one solution is not going to fit all. So you need to be able to say, I need to diversify my studies. I need to be able to look at these populations in order to improve or provide the solutions that are needed. I put in language here because if you do not include this, we cannot change the composition of this country or of the world. We cannot change it, right? It is what it is. And so if you have a patient that comes into the hospital, for instance, and doesn't fluently speak English, and you cannot understand that they're having a stroke, then how are you going to treat them, right? You cannot treat them unless you understand what they're doing. Or you cannot just like tell them, oh, sorry, I can't treat you, go out the door. And it's not something that they can do legally and ethically and morally. They just cannot do such a thing. Again, from a diversity perspective, is that we need to look at the design considerations. Us as technical people and scientists, we need to look at the different considerations. Just like ergonomics. If I'm going to design something that only big hands and very strong people are going to be able to use it, and they have to carry 100 pounds. Well, no one's going to use it, right? No one's going to use it. You need to look at other solutions. So that sort of thing. And if technology is not adopted, then why is it not? From a business perspective, then if you purely say, all I care is about money, well, you know what? If you're excluding the majority of your population from being treated, then you're losing money. You're leaving money on the table. It's just like this. You need to look at your return on investment, and your return on investment is being able to include and get the best outcome out of your device. Because a lot of it is competitiveness, right? So if you're not competitive, people are not going to use your product. You're not provide the right solutions or the state-of-the-art solutions, and they're not going to use your product, and on and on. So that's from a business perspective. So I think it's good to understand the consumer that uses the product and build the products and services that are responsive to those markets. Again, diversity is critical. I cannot say more or less. I wanted to share one more of this. So I don't know how many of you have heard of Coach Corte. So this is a character in literature, from Miguel Cervantes, and he is this person that lives in not in reality, and he moves into trying to battle the windmills because they are the bad people. And he has this sidekick that's called Sancho, and Sancho says, but these are not giants, these are like just windmills, how are we gonna go and fight them, right? And stuff, and he says, what? These are giants. And if you're afraid, then just go pray, and I will fight them. I will fight them. So I think the moral here is that, just make sure that they are giants that we're trying to fight, and not just like the windmills that these were actual, I don't know, wheat and things like that were being made and produced, for the people to get fed. So just make sure that they are giants. A little bit of the law, I know we're running short on time. A little bit, again, I said I decided that I was going to do this law program, and I wish I had done it before, but maybe I would not have appreciated as much before as I do now, or I did at the time, because now it's like I dealt with contracts, I dealt with intellectual property, I dealt with even lawsuits. So if I had known when I was going through this, what I know now after all these classes, I would like, why didn't nobody tell me this? Right? Like not even my attorney told me this, So I could have dealt with things that are separately, because things come as people challenge your intellectual property, or there's a malfunction on your product that you don't want to have, but there could be, and then there's lawsuits and on, and you're having to go to court, and you're having to defend it. And now if you think about it, if you are senior management, or even myself, which was the president, I didn't have it while I was president, but if you are in that situation, then you need to figure out, what you're going to do. So that was the law. One thing that was interesting was this concept within the law that's called IRAC, And it's very much something that we use, also for, in a technical world, is that, you need to look at the issues, the rules, analyze them, and then come up with a conclusion. So it's like, if you have to break down the issues into sub-issues, then let's do it, right? Like, let's understand it. Before we come up with a solution, let's understand all the entire issues. The rules is, it's like, yes, that's understandable. But we need to collect the facts from all the outsides, and then we have to check the analysis against the values. So look for questions, not answers, because if you're just looking for the answers, then what are you solving? Again, going back to what I said before, in an algorithm, if you are just accepting what the algorithm gives you without understanding what is in that algorithm, and if it's correct, and if it's utilized everything that's out there to be able to come up with an answer, then you're gonna run quickly in the wrong direction. I'm not going to, this was quite interesting, but it's gonna take a long time, so I'm not gonna tell you about this. My takeaways are, something that can be done right now is like, learn to write reports, and you think that that's like, why are you telling me this? It's like, learn to write reports, because, it's just like anything, you have a purpose, you have like a hypothesis, you have like the materials that you use, what you're gonna do, what you did, and what the results were, and the conclusion. That's the essence. You don't have to be a literary writer or anything of the sort, but those are the things that we need to see in the real world. And then when you write emails, we do use emails still, by the way. We do outside, but and emails, please don't start with hey, especially with someone you don't know and stuff like that. It's just not professional. But learn to document. Like in medical devices, there's something that says if it's not written, it did not happen. If it's not documented, it did not happen. Doesn't matter how much, when you're in front of an auditor and you say, yes, but we did this and this and this, the only thing he's gonna say, well, show me. Well, you can't show me? It didn't happen, sorry. Let me see, and learn other areas that affect your field. For instance, if you are in software engineering, then learn about hardware, right? Learn about the user that's potentially going to be using that software. And not just like come up with, I think that this is gonna be the greatest thing, and really it's not helpful. Read, travel, talk to others. As I said before, you are in an environment where you can talk to so many people of different kinds, even if you don't like them or you don't agree with them, you can still learn, from all these people. This is the best place. But wait, some of my best friends I met in college. Those were the friends. We say that we met each other when we didn't have titles, when we were just us. I mean, we're still just us, but we're still just like, these are my best friends, and I know I can call them at any time and things like that. And the ongoing is that, never stop learning and always be prepared. When you're having to give a presentation or do something, then you always be prepared. Use the tools that are available to you to continue learning, but don't misuse them either. Just like use them. And then step up and take the opportunity. When you're at work, it's not 8 to 5, and it's not in my job description, that sort of thing, but more, okay, well, I can do this, or I can learn. If I don't know, I'll learn, or I'll help you, or things like that. And you can read those. And embrace change. One of the things that has become very important for me in my career is to build the trust and respect. Because I can tell you that takes you so far. I mean, I know that I can call people that I've worked in, many years ago, and they will take my call because they trust me and they respect me. That's the only thing, just like they will take my call, and they will try to help me if they can, and that becomes very important. You learn from others. I put boomers here because I have nephews and nieces. That was like, you know what? I think one of the persons that I learned when I was first starting my career, that I learned a lot from, was an engineer that was from Poland, and he had been in the resistance, and he was like this. guy, but he was just like taking my hand and telling, he would tell me straight out, no, you shouldn't be doing that, he would just tell me. But then he would always help me, to do this, and, yeah, that was a good experience for me. Don't be a know-it-all, but know your stuff. Be prepared. I mean, there's many times when I don't think I mentioned that I hate biology. I just like absolutely hated it when I was in high school. I just ticked that box and I didn't want to hear about it again, and now I have to hear about it all the time. But at least I know, and I become myself familiar because I know I'm going to be talking to doctors and to other people that that's their life, so I need to at least understand and be able to speak the same language. And then find a mentor, that's important, but always don't think it as a transaction, but more as a thing that you have a relationship with, right? Like not what can you do for me, but let's have a relationship, let's build it. Anyway, and then the future is opportunities. I think you're in a great position. So that's it for me. I know I went, I'm almost, sorry. So I will let you ask questions.
Yeah, all right, let's give Maria a hand. If folks don't have to run off to a class at 1, we're also having a lunch after, so we can take a few minutes of questions now, and then you're welcome to join for lunch upstairs.
And if you have questions afterwards too, then
Professors are invited to.
then you can always ask me later if you have questions now. So because I told you I added a lot of stuff in here, just to give you an idea of where my career has taken me.
Yeah, I have a question. So you transitioned from, you didn't start working for startups right away. People have this idea that you don't even need to finish college to have a startup. Could you speak to advantages of having the career experience that you did when you got to the startup world and you were in the bottom of the pyramid as that person trying to hold everything up, and how that might have been a better time to do it than fresh out of school?
Yeah, so I think that it does give you a foundation of, everything that happens within a corporation. And if you're, for instance, if you're just research and development and you've never seen the manufacturing world, then that's a different whole area. So it gave me, being in both worlds gave me that perspective. And understanding, the different departments and maybe being able to interact with the different departments within a company, it did help me to where I was before. I mean, there are benefits in a startup. The benefits are that you are able to be hands-on in many areas that you would not probably in a larger company. That is the benefit. But the only thing is that you're trying to run in a startup, and you do need to have maybe perhaps a little bit of experience because people may not have the time to teach you. So that would be the downside of startup versus not startup. Plus, if you're starting to start your own thing going, you need to be able to raise money, and the people, unless you're family or your own personal money, people are going to look at your resume and say, what kind of experience do you have that's going to guarantee that you're going to give me my money back? It's important. That's valuable. And if it's not you, then your partner or whoever it is needs to have that experience to be able to help you, and also to understand, you surround yourself with people that have experience in other areas like regulatory, quality. So